Thank you, Mr. Chairman. So I'm happy to be here to present my research work. But this research is still ongoing research. So I appreciate if you give a question or comment after my presentation. So I'd like to talk today about Shortsynch. It's a very simple timed AI program. In dairy farm, the difficulty is in estrus detection is one of the big problems for the reproductive management. There are several reasons for these difficulties, but it is not easy to dissolve this problem. So the fixed-timed fixed-timed artificial insemination (TAI) program were developed. For example, the OV-sync or double OV-sync. But there is some disadvantages of these programs because the cost for hormonal drug and also the labor for treatment of cattle. Recently, simple TAI program, which we called Shortsynch program, has been developed. This program, Shortsynch, will apply to the cow who has a functional corpus luteum larger than the 20 millimeter in diameter and also large follicle, let's say the 10 to 20 millimeter in diameter. The cow will be received the PGF-alpha, and 56 hours later, GnRH will be injected. Then the insemination will be performed at 16 to 20 hours after GnRH injection. In Shortsynch program, treatment for the follicular recruitment is omitted. So cost and effort for the treatment are reduced. Many researchers showed importance of the regulation of corpus luteum before the AI. For example, this figure shows that if the progesterone level is higher than the 0.4 or 0.5 nanogram per ml at the second GnRH injection during the OV-sync program, they reduce the conception rate. To complete the corpus luteum regulation, additional injection of the PGF-alpha during the program was also studied, and it showed improvement of the fertility. However, there is a few information about corpus luteum function during the Shortsynch program. So, in the present study, we examined effects of the function and the regression of CL during the Shortsynch program on conception rate, and effects of the 2 injections of PGF-alpha on regression of CL during the Shortsynch program. We use the lactating cows having a large corpus luteum and large follicle. In experiment 1, 36 lactating cows were used. For these cows, we don't know the exact estrus cycle, so estrus cycle was unknown. In experiment 2, we used 15 lactating cows. For this, we examined estrus cycle of these cows, so we used the cow on the 14 to 60 days after estrus. Also, these cows have a large corpus luteum and large follicle. For hormonal treatment, we used 500 microgram chlorprostanol and 100 microgram of the fertilizing acetate. To evaluate the function and regression of CL, we collect a blood sample at 0, 12, 24, and 56 hours after PGF-alpha injection. Plasma progesterone concentration were examined by enzyme immunoassay. So this figure shows the time course, time schedule of the protocol. In experiment 1, the cows were divided in 3 groups. Group B and C, the cows were received 2 injections of the PGF-alpha with a 12-hour or 24-hour interval. In the experiment 2, the cows were divided into 2 groups. The group B, the cow received the 2 injections of the PGF-alpha with a 12 hours interval. This is the result. The figure shows the changes in the plasma progesterone after PGF-alpha injection. There is no difference among the 3 groups. All cows showed the plasma progesterone level at the 56 hours after PGF-alpha treatment. They are less than 0.5 nanogram per ml. So that means completely regressed. But the 17 cows had low plasma progesterone, actually functional because more than the 1 nanogram per ml, but between the 1 to 2 nanogram per ml at the beginning of the Shortsynch program. There is no difference in the conception rate among the 3 groups, but I cannot say that exactly there is no difference in significance because the number of the cow is still small, so still I'm continuing. But I believe that there is no big difference. Interestingly, when the cow were divided into the 2 groups, that is, the cow has a high progesterone level at the beginning of the program and lower than the 2 nanogram at the beginning of the program, the conception rate is different. The cow having a high level of the progesterone, it shows a high conception rate. So this experiment indicated that when we use the cow having a large corpus luteum, even we don't know the estrus cycle, single injection of the PGF-alpha can induce the complete CL regression. And also the function of the CL at beginning of the program may affect the conception rate. This figure shows the result of the experiment 2. The same as experiment 1, there is no difference between the 2 groups. So in experiment 2, also all cows showed a complete regression of the CL. And in this case, because we use the cow who is in the mid-luteal phase, the all cow had high plasma progesterone level at the beginning of the program. Then the conception rate is no difference among the group, and also that it seems to be higher than the previous experiment 1. So this experiment indicated that when we use a cow in the mid-luteal phase for the Shortsynch program, the presence of the functional corpus luteum at the beginning may cause a high conception rate. So this is discussion. When we use the cow with unknown estrus cycle, if the cow having a low progesterone, low but more than the 1 nanogram per ml, then maybe the process of the corpus luteum regression may be started already. So the timing of the insemination might be inappropriate, and then conception rate will be down. Previous research showed the when Shortsynch applied to the beef cows, the cutoff diameter of the CL for the fertility was the 19.83 millimeter. But generally, the corpus luteum size in the beef cattle, this is a report from the Japanese black, is smaller than the Holstein cow. And also another research report showed the cutoff diameter of the functional CL was 23 millimeter in diameter for the lactating Holstein cows. So from these reports, the indicator for the functional CL, which we use in this experiment, is more than 20 millimeter in diameter. Maybe it's not good, inappropriate for the lactating dairy cow for the Shortsynch program. When we use the cow with mid-luteal phase, the functional CL at the beginning of the, there is a functional CL at the beginning of the Shortsynch. So since appropriate CL regression can be induced, it may have caused the high conception rate. So mid-luteal phase may be an optimal timing to start the Shortsynch program. So present study clearly shows that Shortsynch program should be applied to the cow having a good functional CL, but the further study is required to investigate the cutoff point for the indicator of the functional CL good for the Shortsynch program of lactating dairy cows. We would like to thank ASCA Animal Health for providing the hormonal drug. Thank you for listening.